The safety of the Pfizer-BioNTech vaccine, what you should know. I bet you didn't know about the significant differences in side effects between batches of Pfizer vaccines. It's a hot topic, so let's jump right in. A Danish study was recently published that raised some eyebrows. It highlights large differences in the number of reported side effects between different batches of the Pfizer-BioNTech vaccine. Think about it, not all vaccine doses are created equal. It seems that some batches are causing a lot more problems than others. Even more concerning, out of all the vaccine batches, it seems that only 11 are responsible for more than 50% of the reported side effects. That's a very small number of batches causing so many problems. You might be wondering why nothing has been done about this, and here's the catch. The State Institute for Drug Control, SUKL, has not withdrawn these problematic batches despite this information. They argue that the Danish study is based on a passive data collection system, which they say is unreliable. But wait a minute. SUKL uses the same system and sends the data to the European Medicines Agency. So what's going on here? The Danish study included data from over 10 million doses, making it statistically significant. Slovaks included 337 million doses with 6,010 adverse reactions, what is a ratio 1 to 561. Ignoring these findings seems a bit reckless, don't you think? SUKL has its own data, but it seems to be sticking to the EMA's assessments and not acting on its own findings. One of the most concerning aspects is that the Slovak SUKL doesn't even track how many people have been vaccinated with each specific batch. The Ministry of Health does it somehow, but they didn't have it in the database, even though they should have, because when the vaccine update came, Pfizer had to give it to them, and they can't approve the update without it, and there have already been 2 updates. They even had a legal obligation to produce safety statistics, and since they put the batches on the market, the statistics must be in batches. 2 different government organizations are collecting data and the result. This makes it impossible to directly compare their data with the Danish study. However, even from the data they do have, it is clear that some batches have far more reported side effects. Let's talk about some specific cases. One batch, EJ 6134, was identified as particularly problematic in the Danish study. Sadly, there has been a death linked to this batch from 3 total. Despite this, SUKL continues to claim that all vaccines meet strict safety standards. There is also testimony from a former Pfizer employee who claims that problems with certain batches were known earlier and that efforts were made to cover up this information. If true, this raises serious questions about transparency and accountability. Speaking of transparency, the public deserves to know the potential risks associated with their batch of vaccine. It's about informed consent. If some batches are risky, people have a right to know. In conclusion, it is imperative that the authorities thoroughly investigate these issues and ensure greater transparency. Vaccine safety is paramount, and the public deserves clear and honest communication. Thanks for watching. If you found this video informative, give it a thumbs up and subscribe for more updates on important topics like this. Stay informed, stay safe.